everyone, it's Dr. Wright. Just want to take a minute to talk about the difference between a viral and allergic type responses in the body. When we are, of course, now we're in the full bloom for the area, so the pollen counts are pretty high and it can be difficult to differentiate between a viral illness and allergies. So just want to take a couple minutes to kind of go through some things that you can help yourself to differentiate. So first thing is with a typical viral illness, you have a lower grade temperature that tends to oscillate, meaning it might go up and down. So, maybe like the 99, 101, it's back down, it might go up to 102, it's kind of bouncing around. With allergies, you really don't have that. You won't have any increase with your temperature with allergies. Another thing would be discharge. So typically we think of like a clear white discharge from the nose, or even if you cough something up, tends to be more viral. Can also be allergic. Difference there is that typically the allergy response is more watery. So if you think about the watery eyes and the watery nose, that's more tends to be more allergies. You can have stuffy nose with both, so that's again just something to kind of pay attention to would be the type of discharges you're having. The other thing would be the cough. So cough can be common in both. Difference would be with the viral type cough, it tends to be a bit more harsh and dry. The other allergic type cough is usually more of that irritated cough, not quite as harsh, but kind of from that postnasal drip. Next thing we could look at would be having your lymph nodes. If those are enlarged, that does tend to point to more of not just viral, but bacterial as well. But for purposes today, more of the viral versus allergic could point us in a direction of more of an infectious viral. So that's one way physically we can tell. Next thing we could think about would be the chills and muscle aches that can be quite common in a viral type illness. You can also have a sore throat as well. So that's there. You could have a sore throat with allergies too, but that tends to be a bit different. That's more, again, of that irritated. This is more of like an actual, like really sore throat that you can have in that viral illness. But really with allergies, you're not going to have chills, you're not going to have muscle aches, you're not going to have those kind of symptoms with those. So those are some other symptoms you might be able to tell the difference with. Duration too. So usually most viral illnesses, 7 to 10 days is where an average course would be. And of course, allergies are going to be seasonal. So if you do notice that they're just not really going away, the symptoms, maybe it could be more of an allergic response. And considering too presentation, if someone comes in and they're like, oh man, I've been outside recently, we went on hikes, we were camping or whatever, I usually tend to think more of allergies because you spent more time exposed to the pollen, right? But again, meeting all the other, physical kind of things that we look at, looking in the throat, checking for the lymph nodes. We always look in the ears. Ears both can have some clear fluid behind the tympanic membrane. But with allergies, you tend to think of more of the itching. So the itching ears, the itchy throat, the itchy eyes. That tends to go along more with your allergy type response. Treatment. So of course, if we give antihistamine and symptoms improve, well, more than likely we're dealing with an allergic type response. So those are just some kind of basic things that you can think about to differentiate between. Now with treatment wise, if you've been in with allergies, we always talk about dehist. So dehist is something that does help to process those exposure with the pollen and can help break down histamine. With the dehist, though, it is not as something that you say, well, today my allergies are bad, so I'm just going to take my dehist. You do need to take it regularly for the best benefit from that. The other thing is the Southwest Allergy Blend that we have here for spring. Those are the little white balls, little pellets. That can be quite helpful as well. Vitamin C, we know, is good for immune system, but it also doubles to help break down histamine in a higher dose, so can double duty for allergies and for immune viral type illnesses too. Now I will mention we did post about the IV vitamin C that is being used now in several hospitals in New York. That is great. We've been doing that for years in naturopathic medicine, And we do offer that for our patients too. Benefit of IV is, of course, you're bypassing the gut, so you're going to be absorbing all of that. Moving on to other viral type support. So we always talk about an immune support in general. Vitamin A is excellent for that. Vitamin D as well. And then if you've been in, we're always recommending the Immune Plus tincture. This is really helpful, can help kind of preventative as well. So for more information on specific dosing for you or what you should be taking, of course you should schedule a telemedicine or phone consult. We can kind of walk you through that. And if you really aren't sure, like, is this viral or is this allergies, then of course, schedule a telemedicine phone consult and we can kind of help you to differentiate that and get an appropriate treatment plan in place. I'm looking forward to seeing you guys soon. If you have any other questions, of course, you can always message us through the portal or give the office a call. And you guys stay positive out there. We'll talk to you soon.